Leader's healthcare situation has been in the spotlight over the past year as local residents dealt with a full hospital closure. Now with the services back on track, including a full complement of 3 physicians and a nurse practitioner, the community and the health region are looking forward to the construction of a new integrated healthcare facility. Over the past several weeks, consultants have been busy working on the functional plan for the project. The report was presented during a special health board meeting in Leader on Tuesday, with health officials and community members in attendance.
Because we've had such great community and staff engagement on this project, we wanted to do it a little bit differently by ensuring that the community has an opportunity to see, what it is that we're doing. And this is very different. And I think the more times that we can introduce new ideas of how we can provide health care to the people who actually access those services, I think it starts to create a better comfort level for them to be able to understand that while it might be changed, really our goal is that it's better.
Now that the functional plan has been approved by the board, the health region will make a formal presentation to the Ministry of Health in October, making a bid for provincial funding to move on to the project design and actual construction stage of the project. The new facility will be incorporated into the current building of the Western Seniors Home. And once constructed, Leader and area residents will see a number of enhancements in healthcare services.
When we talk about having access to acute care beds, that would still be available. When we talk about primary health care, which is those clinic kinds of services, that would be available. EMS, we're talking about looking at how do we enhance that, and then looking at that case manager component. So how would that all work together? When we're looking at the design of this building and talking to our staff about how patients will flow through the building, it actually creates an environment where they're working together more as a team.
A new facility which will be welcomed by healthcare staff like Nikki Miller, who's worked in Leader for the past 6 years as a nurse practitioner.
I am hoping that with this new facility that we will work closer as a team, more collaboration, be able to use technology more than we have or ever thought we could, as well as retention of the staff that we have now, nursing, x-ray, any of our staff, as well as our physicians. We currently have 3 doctors recruited here, working here, and we want to keep it that way.
And from the town's perspective, having 24-hour healthcare is crucial to attracting and retaining residents and serving surrounding communities who also depend on Leader for healthcare services.
We've got a lot of development that's going around the town, the area, and it's a big thing, right? When you talk about having a welcoming for younger families, kids, you need that, right? You've got all kinds of accidents that are taking place. So have a hospital like this, an integrated facility like this, it's great. And even on the other end of things is when you're looking at senior care. The more that we can have our seniors stay in our communities so they don't have to move to the bigger centers where they're, maybe get lost in the shuffles. There's more of that personal care when they get to stay in their own hometowns and have that care delivered to them.
Once approved by the province, the design stage will begin on the estimated $8 million Leader integrated healthcare facility, which will include 6 acute care beds and 10 multi-use beds. Southwest TV News will continue to follow this story as it unfolds.